So I'm really excited to be here to talk about using data to create change. And I think yesterday's keynote really set us up for our presentation that we're about to give. How can we use data to help create change outside of your organization and to impact people's lives at a system level? And that's really what we're trying to do in Minnesota. So I'll give a little bit of a high level of what we've been doing and where we're going. And where this is especially exciting is we're actually doing the entire presentation in Tableau so that we can show you and interact with some of the dashboards that we're using within our organization and with our partner organizations. And I'm going to have Ben, my coworker, come up and show you exactly what we're doing. And the dashboards are actually connected to our warehouse. These are, we won't go into the data necessarily because the data is private data, but we wanted to show what we're really using, not just something that's a skin over some fake data, but to actually show you dashboards that we are using in our organization connected to real data about people. So when we're using data, a lot of times we're thinking about how we can create an understanding, maybe just when we're starting off, just even within ourselves. Like when I think about when I first started using Tableau to understand data 9 years ago, it was more of a curiosity, a personal curiosity. What can I learn about our data and the data that we have about our programs? And then as we continue to leverage that data, you start to think, how can you spread that information and that knowledge within your organization? But really, when you want to create everlasting change, especially when you work in a field such as government, you need to take a step back and really think about change at an even bigger level and apply that data and that new knowledge across an entire system. And I'm really excited that we as an organization are at that point where we're not just leveraging our dashboards and our data within our organization, but we're taking that information outside of our organization and putting that knowledge in front of our partners, 87 counties, 11 tribes, and 4 healthcare organizations, so that they can also take that knowledge and really impact, in a positive way, the people that we serve. A little bit about DHS. Minnesota is a little unique compared to many other states. The Department of Human Services is a very large umbrella organization that oversees many, many programs. We cover everything from Medicare to child protection to all of the cash benefit welfare programs. We are the licensor for child care centers. All the background checks for the state in the human services system funnel through us. So we handle a lot of information about many different programs, and it all funnels through the Department of Human Services. In all, about 1 in 4 Minnesotans at any given time receive some kind of service from our organization. And we have data on those individuals that we serve. The other thing that's slightly unique about Minnesota is that we are a state-supervised, county-administered system. And what that means is, for the most part, the Department of Human Services doesn't directly administer our services to the clients. Our partners are the ones that have that client face-to-face interaction. And in Minnesota, our partners are 87 counties, 11 tribes that have transitioned from the counties to their administering their own human services systems, And then right now, about 4 major healthcare provider networks. So they're the ones that are actually out there in the field working with those 1.4 million Minnesotans on a daily basis. So when we want to improve the experience of our clients, really we need to leverage that partnership and make sure that the change that we're creating happens not just within DHS, but happens at the provider. So we need to empower them as well with data. When we think about our data, I mentioned all of those programs. What we try to do is to look at all of the programs and see how they wrap around an individual. And the way that what we use to frame that is, it's called the social determinants of health. Basically, what we're trying to understand is, across all of the program areas, how are we positively contributing to 8 key outcome categories? So everything from housing to food security to transportation and to just general health and well-being. And when we look at all of the data that we have, we can then take that and apply it all the way down to an individual level. And in a little bit, Ben's actually going to show you some places where we've actually done that. Tableau's been probably really integral in how we've done this. And so as I'm going to talk a little bit at a high level, I'm going to show you how we built out our Tableau Center of Excellence across 6 key areas: desktop, visualizations, actionable data, audiences, developers, and server. So as we're kind of telling our story, you'll see how we grow or how we grew in each of these areas. And that's what's really allowed us to create that actionable change. Not just focusing on one part, but trying to, just like we do with our human data, using the same approach to in our deployment of Tableau so that it wraps around and we're more comprehensive in building out our Center of Excellence. So where we started was back in 2015. So I was brought into the Department of Human Services to help build this out. In 2015, we didn't have Tableau. So this is what our Tableau Center of Excellence looked like. It was like 0 everywhere. Like we had no capabilities in any of the Tableau field. So I brought on Tableau, and I was desktop license number 1. And part of what's really exciting about when Ben and I get to present together, Ben was desktop license number 2. And so we were kind of like at the start of the whole journey. And it's been really, really exciting. So what we first did is we tried to deliver dashboards and analytics within our organization. So when we talk about moving towards system change, we first needed to increase our capabilities and our capacity within DHS. So we did self-service analytics. We would develop dashboards in an iterative process. So it would be Ben and I sitting in a conference room with our leaders, having them ask questions of our data, and in real time generating the answers to the questions that they're asking, such as we would be connected to our healthcare data, and a director in the meeting asked, well, what percentage of children experiencing foster care are actually receiving mental health services? And like that, we were able to answer that question. And by delivering the analysis and answering their questions in that iterative process, we gain the support to continue to build out our Tableau deployment. From the 2 desktop licenses that we initially had in February of 2015, to now we have 125 desktop licenses across various developers within our organization. And we've deployed a core-based server to help share the analysis within our organization. So we started to build out our Center of Excellence. we saw growth in the desktop license field. We started to create, through that iterative development, actionable data. And we deployed our first server. And early on, I would say, and you'll notice the developers, so we were really strong in the desktop licenses, but you can see the developer support only moved a little bit compared to the desktop licenses. And that's because by doing a fast grassroots kind of expansion of Tableau, it was really challenging to build that support for the developers while we're getting desktop licenses to the developers all at the same time. And this is an example of what one of those iterative dashboards ended up looking like. So the question was asked, how are American Indians in Minnesota utilizing our services? So we went to our data and started asking questions of it, and started pulling things together to paint a picture of what the utilization of DHS services were for American Indians. Interestingly, as we're doing this, other questions are being asked. So we're looking at our data. It's all at the individual level. So underneath this is about 600,000 rows. So a fairly small data set. Because we're looking at everybody receiving our services, not just American Indians. And we're discovering, wow, so 55% of American Indians in Minnesota are utilizing our food and cash assistance programs. But what was more surprising is 62% of African Americans in Minnesota are also utilizing our services. And where that's slightly concerning is when we think about the institutional pressures that community is experiencing. It's a much larger community in Minnesota than the American Indian population. There's about 55,000 American Indians in Minnesota. And in Minnesota, there's about 290,000 individuals that identify as Black or African American. So when you start to see 62% of a much larger community utilizing programs that are part of our safety net, then that suggests something's happening. And we can start to see, paint the picture of what's happening at an institutional and a system level within Minnesota. So using things like the American Indian dashboard, we started to take the insights that we were developing and go out to our partners and providers. And what it would look like is myself or Ben working with subject matter experts within our organization, asking a bunch of questions, and then taking that dashboard and going out and meeting with a county or county staff. And then having them, just like we did within DHS, with that iterative development, having them do the same thing. So take a dashboard that we've partially developed, go out there, and just have them in real time ask questions about the recipients that they're surveying in particular. And what that really allowed us to do is to start to generate that interest for data outside of our organization as well. And this is where we really started to see growth in both the actionable data, the need to support our developers much more as we're doing this. So building out our center of excellence with additional training, with more consolidated and streamlined data access forms. I don't know where you all work, but in DHS, we're pretty siloed. I know that it's really unique to our organization. Everybody else, I'm sure, is not. So if all of these different programs, the data is stored in different places. So we need, and the process to gain access to that data is different for each system. So what we worked on for our developers was to create a streamlined single form instead of the 10 forms that would then be passed to our data privacy and our data security officers in order to grant data access privileges to analysts in a more comprehensive way. This was like brand new for us. Like we had never done that before. People are just traditionally used to just accessing their program data. But where we've been moving is, again, thinking about it more holistically in an integrated way, wrapping around the people. So we started taking these dashboards out to the counties and to the tribes and the providers and started having them ask questions. But we want to create more change than just these one-off kind of data exploration activities. So where we are now is to then take that and push more data out to our partners and our, in the counties and the providers, and open up our Tableau server, which had been just internally facing, and allow them to interact on an ongoing basis with the analysis that we're doing within our organization. So now we have 87 counties, 11 tribes, and 4 healthcare organizations that can access our internal server. It's no longer just siloed or just partitioned to our organization. We're treating, we're looking at the entire human services system as kind of our organization now, rather than just what's within our particular building. And using the same lessons that we learned earlier with doing iterative development, doing interactive dashboards, and allowing them to explore the data themselves to build that out. So what this has meant is we're seeing interactor growth go from, I think right now we have probably a stable 200 interactors like hitting our server on a regular basis. And now that's going to grow to 5,000, potentially 5,000 regular interactors, because we're developing dashboards that will go all the way down to the frontline worker to help them with their case management. So if they want to see a comprehensive picture of their caseload, they can go to a dashboard on a daily basis and see information about all of the clients that they're serving. And again, this is not a DHS employee. This is a caseworker in Anoka County, so a separate organization. So there's all sorts of interesting challenges related to that. Ben and I don't work in IT. And so what's been really helpful is to establish a strong partnership with our IT department to help support that. And I would say the partnership is getting there.
They still let us in the door.
Yeah,
Nice.
they haven't fired us yet. But really, in order to do this and to support this, we really had to build out kind of all across the board. Building more actionable data sets that are relevant to the caseworkers, adding more audiences. I think the biggest challenge, and we haven't seen the growth there, is we need to figure out how to better support our server environment and figure out what that will look like. You know, we currently have 8 cores, and we're anticipating 5,000 regular users on an 8-core server. That's a little tough. So we need to figure out what we're going to do for that. And so now I'm actually going to turn it over to Ben, because really what we want to do is, you know, it's all fine me talking and painting the big picture, but actually show you what is creating all of this change for our partners and providers and helping build this out. So.
Thank you, Nick. Good afternoon, everybody. So my name is Ben Van Hunnick, and I am an analyst with the Housing and Support Services Division with the Department of Human Services in Minnesota. And Nick has been talking about this grand, awesome view, high-level view of what's been going on with Tableau at the state. What I want to do is I want to talk about one distinct path, one of many paths that are happening that go from the high level all the way through down the levels actually to the person. So there are many other efforts that are resulting in this type of outcome, but I want to talk about one specific to the housing division. And this is a graph actually that Nick created using this data set that we built looking at this. Is this homeless?
No, that's
people. This
everybody
is people.
that received food and cash programs.
Right. So this is coming from the Maxis system, and Maxis is our food and cash assistance eligibility and payment system. And I didn't have the great idea to do this. Nick did, just to look at the trend over time of just enrollment. And I'll be honest, no one has ever asked that question at the state. They were looking at how many people are on this program at this time, how many people are on this program. And Nick said, well, how many people are just in the system in general? And so I thought that that was a very powerful moment for us. So this is the start of just asking more questions. I think you always know when a visualization is working because people have more targeted, good questions, as opposed to, that's great, next session, you know? So, so I think that that's that's a personal opinion of mine. That's what I've found is that when people start to ask questions and engage and don't stop asking questions, that can actually be a good thing because they're engaged in it because they want to get to where they want to go. All right. So as I mentioned, I am from the housing division at DHS, and we primarily use the Maxis system that I just spoke about. And as you can imagine, this is an admin system for eligibility and payments. It was not set up to do evaluation. But we are a glass half full, so what we did is we created a homeless algorithm to look at different elements such as address, possible facility stays, things like that, in order to determine if we think that somebody is homeless, if it looks like they're homeless. So after developing that, we wanted to put together some dashboards to look at homelessness through this algorithm, specifically through the lens of the Maxis system. So looking at everybody in Maxis, not just the programs you may be working on. And one thing about Minnesota, and then this is common across the country, I'm sure, when you're addressing homelessness, the funding for homelessness comes in a wide variety of different packages from different places. So there's federal funding, there's state funding, there's county funding, and there's community funding. But we thought that it would be helpful in order to show what is going on, at least in our system with homelessness, in order to do more planning about where do we want to allocate this. So this dashboard is looking, the map, the gradient and the numbers reflect the percent of people in that county right now that is experiencing homelessness. And then below that, it is broken out by single adults and by families underneath, and then cross-tab by the length of time someone has been homeless. Okay? So, I'm sure you've all heard of Minneapolis, home of the Vikings. Let's see here. So when you click on Hennepin County, that's where Minneapolis is, Hennepin County. What you see is obviously there's a high concentration of people who live there, and so the percent of people compared to the other counties, so this is the spaghetti graph on the side here. This is looking at the trend over the last 10 years. And so that big data set that with the graph that Nick built, I used some of that idea with this. And so it's looking at the percent in Hennepin County over time. Now, if you were just looking at the percent, you'd see it's one of the higher percents. Okay, and there's this many people who are homeless. But I think it's important to note that you see the dip there. That may be a result of all of the action and interventions that have been happening in order to address the issue of homelessness. So it's an important piece of context other than just looking at there are this many people homeless right now, and this is what's going on. But you take a look at Monoman, which is smaller county up in the Northwest. So they have, I think, close to 13% of the people in the county are hitting the homeless algorithm. And the trend is not looking so hot over the last 10 years, okay? This is important, and this is something that happens in the homeless world a lot, is a lot of the people out in greater Minnesota will be like, everything is metrocentric because you're seeing these numbers that are obviously larger than our numbers. And so we feel that the funding is going this route. Well, what we want to show, that's a good point. We need to tell more of the story of what may be going on out there. Maybe Monoma needs more, not only funding for homelessness, but it may mean more infrastructure for housing. Because it's trending in the wrong direction, even though it's a smaller amount of people when you're just comparing the numbers, right? So it's kind of unpacking the metro versus outer state elements. So impact of this, we are sharing this internally now. There are a lot of planning grants going on right now, and so people are starting to look at this to get more information about where do we think that we should allocate this funding. And also, what type of housing units are we going to need? Are we going to need apartments, one-bedroom apartment, or are we going to need a two-bedroom apartment because of the idea of homeless families as well? So, but the one thing I'm happy to say is the housing division actually has an answer, one of the many answers to this issue. So the housing support program, the housing division administers a housing support program. I know I'm saying housing a lot, but I'm in that world and I can't help it, okay? The housing support program administers numerous different setting types, so payments for setting types. Those include adult foster care, assisted living facilities, and assisted living situations in the community, as well as board and lodges. But it also does supportive housing for long-term homeless people. Anybody heard of supportive housing before? Awesome. Supportive housing basically helps them with the payment for the apartment, and then it helps with the payment for a case manager to work with them to help them remain stable in their housing. And so it's kind of an all-encompassing program. But the one thing that I wanted to show is that in the housing support program, you kind of have to go through the same rigmarole to administer these programs. So on the left here, you see this is by a number of people where our supportive housing is happening for long-term homeless. On the right is where everything else is happening. So the point of this is to say, look, you're in the business of housing support. You've gone through, we have a lot, this is, DHS, so there are a lot of things that they have to do, a lot of boxes to check in order to administer the programs. However, there are some counties that aren't doing much at all in terms of supportive housing. Now you go back to that dashboard and you say, and you have a problem that you hopefully can fix with this funding source or some other funding source somewhere else. So the impact of this is this has gone to the legislature. Our DHS leadership carry this around to show people, and this has been very powerful in conversations with counties, because they'll say, I don't know much about this supportive housing program. And you're like, yeah, but you know about maybe the board and lodge that you're doing in your county or the adult foster care. This is, yes, another angle, but it is something that is underneath the same umbrella, and you have a problem that you can probably help solve with this program. And it's working. Counties are like going back to their county leadership and saying, okay, yeah, we got to do more of this business. Because the funding source is there, and right now it's not capped. Don't go tell anybody that because I don't want it capped. But right now it's not, so we need to administer more of this funding in order to solve this problem. Okay, but then people say, yeah, but does supportive housing for long-term homeless people work? And so what we did what I did is created a dashboard that I have to admit, this was a bit of a fever dream that I had about 10 years ago. I didn't know if I'd ever be able to do it, and I didn't know if it would have any impact. But I'm just going to dive right in and just tell you what this is. This is 2,400 people. Each line is a person. Each column is a month, and this is 5 years worth of data. The commonality with everybody is that in December of 2014, they were all in supportive housing that we administer. On the right is the breakout of where they ended up 2 years later, and it's also the color gradient for what is happening. So at the top, you have our supportive housing program, and then you have some other permanent housing that we can see in our system. But as you go down in the gradient, it becomes less permanent, more crisis, to the point of homeless right there, and then at the very bottom is not in Maxis anymore. Because another thing that has been very powerful for us is to show, I know you think that people just come in, everything gets fixed, then they leave, everything's all right, everything's good. Well, sometimes that doesn't happen. And sometimes they're not consistently in. Sometimes they churn. So, I didn't even really present this. I just showed this to a couple of people, and all of a sudden people started calling it the green screen. And then they said, give me a PDF of that, and it's kind of taken off. So I'm glad my fever dream actually has a little bit of value, because building this was a little bit of a chore. Tableau was about the only software I probably could have used in order to do this. But what has been really, really interesting is our assistant commissioner has this PDF, and she goes, when people ask me if our programs are having impact, she'll just show them this. And so this is an example of impact, because you'll see the stabilization of green for a lot of them remain. What I've actually done is I went and looked into the other permanent housing, so they ended up there, or address unknown. What I found is the vast majority of them got SSI or RSDI, and may have got their income gotten high enough to not be eligible for the program anymore. But they're still receiving benefits such as SNAP, food assistance, and things like that. So, but what's also been nice is that we've had some case managers, people who do the work, and are working with people with very high barriers, and feeling a bit burnt out. I have heard some instances where they're at a meeting and they're hearing them complain and worried about budget cuts, and then what they'll do is they'll show them this, and their demeanor changes. They're like, look, you are doing something, and we're doing everything we can to try to show the impact of what you're doing. And they've been very, very appreciative of that. To be like, yeah, I know you're not working with 2,400 people, but I'm just telling you that this is something that is very, very powerful. And I'm happy to say we recently crossed the 3,000 people in a month threshold, and it continues to grow every month for people who are doing supportive housing. But the last thing is, okay, I see there's a problem. I see that we're not in the business yet, or we need to do more of the business. And you say there are this many people, and the model works, but I don't know if we can take on everybody all at once, like the rest of the people who are struggling right now. Okay, so how do we prioritize? So one of the things that Nick and we've had this goal for a very, very long time, is to do more and more algorithms, to look at different ways of drawing out people who may need more help right now. If you needed to, I mean, we're in a world where you do have to prioritize. I wish we weren't. We just kind of are. But a couple of the algorithms that we developed, we're looking at chronic homelessness, so we're counting the number of homeless months that somebody may have. So they have 6 years or 10 years of homelessness in the Maxis system. Another thing that we're looking at is we call the instability index score. This is something that's still in development, but it goes along the lines of what Nick was talking about with the social determinants of health, grabbing data to try to determine if based on their past that they are at risk of more instability in the future. But this one is looking at multiple setting stays. So the Maxis system tracks different setting stays that people may have, either that we're paying for or that impacts the benefits, the other benefits that they may be receiving. And we saw a small number of people having a ton of stays. So what we decided to do is take a look at them and see if what was going on. And of course, there's a high correlation of homelessness as well that was going on there, because there's general instability going on there. And so what this is just looking at a quick snapshot. Every circle is a person, the size and the color of the circle is reflecting of how many facility stays, setting stays. But you have, a person who's got, 91 setting stays. My feeling is we should look into that to see what's going on. So the impact of that is we are working with counties, and so here's a quick example that we had there. But we're working with counties. We are going upstream, so we are doing the dashboards for the legislative entities, for DHS leadership. We're going downstream to the counties. We're doing the dashboards for their leadership. And then we are doing lists of people to housing specialists at the county. They're the ones that put the data in. We're the ones that give it back to them. And what we're doing, they're doing their own case reviews and saying, yeah, you're onto something. Because they knew the story, they just didn't know who. And what they're finding is that they are struggling in even more systems than we can even see, because they're looking at their own data at the county level. And so right now we are gaining momentum with doing this high level all the way down to the person level. So try to get more funding to be more strategic, but also to go to the person level and to hopefully get them stably housed. Okay? I'm going to turn it back over to Nick.
So if you think about like what we're trying to do, and for the most part, we're leveraging existing IT resources to deliver this information to our partners, and as Ben described, upstream and downstream within the human services system. But we know that there's going to be a demand for more data, and we need to make sure that that data is, as we transition to dashboards, especially at the downstream, at the caseworker level, that they have the most recent information. So it's not just monthly uploads or monthly updates of data. They're going to need data that is current. So looking at data that reflects as people are entering information into the system. So this is kind of a high-level architecture of essentially what we're doing in order to empower caseworkers with more data and an analytics that will occur faster. So we have a large Hadoop deployment. We're then creating a staging environment that migrates data from the mainframe servers into Hadoop. And then our dashboards will be on top of Hadoop to allow us, to give us the processing resources to support those dashboards that the county workers will be accessing on a regular basis. And then what we're also putting in this, and this is where I get really excited, tying back to the social determinants of health, is predictive modeling for caseworkers. So if you look at an individual's history, you should be able to take that, and then there's a probability that they're going to experience some kind of outcome in the future based off of what's happening. So there's the easy ones, like if someone's homeless. If someone experiences homelessness once, there's an increased probability that they will experience homelessness again, for example. other things that we're able to pull in is substance abuse. So if people are experiencing chemical dependency, how does that, we can then spit out through using R and Python, and so that's where the little R box is, putting that in the Hadoop, so the Hadoop's running the analysis, and then generating kind of an outcome score for caseworkers so they can see, like, if someone is experiencing chemical dependency, how does that impact that individual's probability of a negative outcome, such as premature mortality or long-term instability. So that's what we're trying to do and trying to pull it all together. And the idea is that that information is then going to the caseworkers in the human services system at all levels. So we're in the process of adopting what's called the Integrated Human Services Delivery Model. And it's basically looking at how people enter the human services system and where are they receiving services. So it's screening, triage, referral, eligibility, assessment, and service coordination is kind of the, if you look at how an individual receives services within human services. It's a lot of services. But how do we make sure that that data is getting to the caseworkers at all levels of when an individual is moving through that system? So we wanted to make sure that we had time if people had questions. Yeah.
How did you overcome all the federal regulations, the regulations in the publication 1075, and putting this data together, and then when you're reaching out to the providers where that information should not go to? How did you overcome that?
So so this is the advantage of DHS being a big umbrella organization is when you look at, interesting, like HIPAA for us is like actually the easy part. Minnesota has very aggressive data privacy laws that increase the standard beyond HIPAA. So we have to meet those in addition to just general HIPAA requirements. But essentially, because they are, by using the Tableau server and it being hosted at DHS, like in our secure EDC, when a provider is logging into the server, they're coming into an encrypted channel to come into DHS, and people that are accessing have done the necessary data security and privacy, and so they are an authorized user of that data.
Even your providers that have access to certain data within DHS?
Yes. Well, so I mean, the thing with like providers accessing the data, so like, you know, when some of the dashboards like that Ben showed, like those are going to counties. The stuff that's going to providers, we have to address like certain security aspects with how the data is architected underneath the dashboard for providers. And this is like one of the tricky things of like understanding who your audience is and making sure that the data is structured appropriately because we're trying to send it out to multiple audiences. A human services caseworker is pretty easy. Like they're entering that data and they're entering HIPAA data as well, because one of the things that you, in that first slide about DHS is, you know, we also oversee the healthcare exchange. So you have front-end county caseworkers enrolling people in Medicaid or Minnesota Care, and they're entering that in their office. So that, you know, we're looking at secure health insurance data. And because they have the authority to see that data, that passes their data access privilege to DHS, and that helps us with granting access. Yes. Oh, sorry. Multiple hands.
So I work out in coordinating government and see similar health disparities
Mm-hmm.
Based on systemic racism. And my question is that it looks like you're doing a lot to reach out to clients using Tableau. Is there an effort, or will there be an effort to look upstream and look at developing anti-racist policies or reviewing policies or changing the larger systems?
Yes. Short answer, yes. So this is actually where I get to spend most of my job. Ben gets to like have fun and play in Tableau, and I've like moved in my career where I don't actually get to play in Tableau, which is why I get all the boring slides and he gets the fun slides. So we are just in the process of rolling out a strategic plan, and in our strategic plan, there is a lot of emphasis on developing policy and changing this human services system to address systematic disparities within Minnesota. So, and in my role in that is to coordinate the analytics and research to support that policy change. So, yes.
This might be a little bit in the weeds because I work in homelessness as well.
All right.
Yeah, I was wondering, how do you use your homeless management information system data to inform your population location data?
Yep.
Because it seems really specific,
Mm-hmm.
and I feel like our HMIS data doesn't get down to like that level of detail.
Yep.
So are you supplementing your
You
data somehow?
just made Ben's day. Like,
My past job, I was heavily involved with the HMIS system, the Homeless Management Information System. This is a HUD-administered network of systems, would you say? Mandate from HUD. Yep. Yep. Yeah. No. Right. Yep. Yep. The elephant in the room is that there's a heavy crossover with the people that we're looking at here, but we don't know exactly who, because the HMIS system is outside, one of the only things in Minnesota that's actually outside of the umbrella. Yeah, it is. To the point of some of our own funding is tracked in that system, and we struggle to talk about our own programs that is tracked within that system. So we did do a feasibility kind of a testing project where we took a sample set from HMIS and then tried to do matching in the Maxis system, which is feeding that. And we had some success. And then they said, well, now if you really want this ongoing, you have to go into the IT gateway, which, don't hold your breath kind of thing, because we're responding to certain lawsuits and things like that. But that was actually, people didn't think it was a big deal, but I thought it was a very big deal in the sense of you can do some matching, because then you can flesh out the story even more. The one thing that I say about this is that I'm trying to tell you everything I can about this system, right, by a person. But it's also showing them, we get access to the other systems, and then we do the same type of thing, you're able to flesh out even more. Because when people see that, they're like, have they ever been in the HMIS system? That's the first thing that people always ask. So we're making a little bit of headway with that. But one of the things is when I started at the state, I don't think anybody was expecting me to create a homeless algorithm in Maxis and then talk about homelessness, but I'm like, well, I come from that area, so I think, and it's a major determinant of people's health and housing and things like that. So I would rather do that and then create, hey, what is that going on over there, like that type of conversation, as opposed to, we're not looking at the full person. So making a little bit of headway. I'm glad you asked it, because we did the feasibility study recently. Would love to have all that information, and everybody would. We are working on trying to get it into our warehouse. So,
I think what's really, really exciting, you look at the data that we're actually analyzing, most of it's just administrative data. It's like, someone walked into a county office, signed up for food assistance, their application was processed, and then we can see like their utilization of food assistance. But it's all, there's a lot of times we have conversations, with individuals, especially, I come from the evaluation world. That's my formal training. And I'll talk about social determinants of health and measuring outcomes, and people will be like, well, you're looking at administrative data. How can you possibly infer outcomes from just administrative data? And I think some of the stuff that Ben has done, we don't have access to HMIS right now. But we can take that administrative data and through creative analysis in Tableau, because Tableau allows us to do this, in real time, make reasonable assumptions to get at those outcomes. So Ben will talk about his homelessness algorithm. Some of the assumptions that Ben's making is if someone comes into a county office to get assistance and the address that they put is a homeless shelter, they're probably homeless. Most likely.
I'm gonna put money on it, yeah, that they're probably homeless right now, or they're unstable in their housing right now.
Yeah.
I would definitely say that.
So we can take that administrative data, put it into Tableau, and then be creative in kind of figuring out those outcomes. What is the person experiencing?
And one other thing that I would add to that is that the partnerships with the counties have been just a crucial part of this, because the deal is I'm dealing with an algorithm and saying this is looking like this is the situation, but you have their case notes, you can look across your county systems, and we've been doing some testing of this, for especially the instability index score and actually the multi-settings. Hennepin County stepped in and did case reviews of the multi-settings people, and then Anoka and Hennepin both did the instability index score, and we gave them the top 10, and we didn't tell them how we score it. We didn't tell them even what's in it. We just said, here, it's a variety of different things in your person's life, and then you just go look and then come back to us and say, do you think that this is gonna be valuable? And I think they went through the top 5, and they said, we're kind of sold already, because I was just grabbing adults, and it turns out half of the top 10 were actually parents. They had kids, and the parents had been in the system as a child. Yeah, and then they were telling me all of these other things. I'm like, I don't even have access to some of what you're talking about. The fact that some of the chaos going throughout some of their county systems as well. Detox is a hard thing for us to see, but they have an ability to see that. So this is the real fun part about the collaboration is we're not alone in these algorithms. We're talking to our partners and having them help do case, because we want this to be helpful. We don't want just to do this for, the heck of it. So it's been a really powerful experience for us.
There's a question over here.
So thinking about social determinants of health, are you keeping multiple sort of data systems and then linking based on the individual?
Yep.
Mm-hmm.
Yep.
There were a couple.
Yeah.
Oops.
It's gaining access and integrating data across systems. I'm sure it's not just in government, but it's quite the exercise in patience. So the first was we did not have a process to gain access to multiple systems outside of your current division role. So the way that it worked is, Ben started in the housing division. So when the IT folks, start giving Ben his data access privileges, they would be like, all right, Ben, you get access to housing data only. when you start saying, well, I work in housing, but I want access to Medicaid data as well, because people that are in the housing program are also on Medicaid, and we want to understand their utilization of healthcare services. We didn't have that process. So we actually had to develop the process to grant access to multiple systems. And it was like 4 months in rooms with attorneys and data privacy people, and something that I wouldn't wish on anybody. Right. Generated a whole form and like an authorization process that is different from the traditional. So I probably can't share with you the form, but I can share with you like the process that we did. So that was the first big kind of hoop. The next big hoop was the technical aspect of it. So I know like everybody like has all their data in like one place.
But we didn't.
But we didn't. So our data is stored in Teradata. We have a Teradata data warehouse. We have an Oracle data warehouse. We have Microsoft SQL Server data warehouse. We have obnoxiously large Excel files. So we needed to get all of that data into one place. And that's something that we're still struggling with. But by moving to a big data platform like Hadoop, so we're leveraging Cloudera Hadoop, we've built the data flows to essentially create copies of each of those systems in Hadoop. So now at least it's all stored in one place. So that will help with the integration component. But those are kind of the two big hurdles that we had to overcome. I much prefer the technical one over the bureaucratic one, but I work in government, so.
The 1+ is the unique identifier in the Medicaid system, and the Maxis system is the same number.
Yes.
It's called something different. One's called the recipient ID, and one's called the person ID, but it is the same number, and that was a big, obvious help.
And
to not have to do matching between those two systems.
And that ID, there's a similar ID that we can use over in child protection as well. So,
yep. So that was a win.
Yep. Any other questions? Yes. Mm-hmm. Yes, we are hoping to. We do push things publicly currently, and we're leveraging Tableau Public to do that, which is all sorts of fun. But we're working with other state agencies in Minnesota to, essentially what we're hoping to do is secure a Tableau server just for public deployment, and then share that across our different agencies. The city of Minneapolis did that, so we're kind of using them as kind of a case study of how they did that. So. All right, cool. Well, thank you guys y'all for coming.